Pap smears are the most common method for screening for cervical cancer. They were invented by the Greek cytopathologist Dr. Georgiou Papanikolaou. They are cheap, they're quick, but they have a poor sensitivity, only 54 to 72%. So the South African policy of doing pap smears 3 times in a woman's life for screening, that reduces the incidence of cervical cancer by 64%. So it's not perfect. 5 yearly screening with pap smears reduces the incidence by 84%, and if you move to 3 yearly screening, it reduces the incidence by 91%. So that's why in countries with greater resources, they have a much lower incidence of cervical cancer. Let's look at some of the results that you might get from pap smear. So there might be abnormalities of the squamous cells, and this is the most common result that you're going to get on your pap smear. Ascus means atypical squamous cells of unknown significance, and LCIL means low-grade squamous intraepithelial lesion. That's the equivalent of CIN1, which is a result that you will get on histology. 57% of patients with LCIL will have spontaneous regression of the abnormal cells, and only 1% of LCIL cases will progress to invasive cancer. So for that reason, for those conditions, ascus and LCIL, the treatment is to repeat the pap smear in 6 months to 1 year. If it's still abnormal, the patient goes straight to colposcopy. But if there's just one abnormal case, you repeat it in 6 months to 1 year. Some other squamous cell abnormalities are ASC-H, which is atypical squamous cells where you cannot exclude H-cell, and H-cell itself, which is high-grade squamous intraepithelial lesion. That's the equivalent of CIN2 and 3, and 12% of those, more than 12% of those, progress to invasive cancers, and only about 30% of them regress. So those are more serious, and they both require colposcopy. If you find squamous carcinoma, you need urgent colposcopy as your treatment. Okay, let's look at some other cell abnormalities. Glandular cells can also be abnormal. So those are cells from the endocervical canal. Atypical glandular cells also warrant colposcopy. And you can also find adenocarcinoma and adenocarcinoma in situ, those require urgent colposcopy also. You can also have abnormalities of the endometrial cells, and for those you need to do endometrial sampling. So that could be, for example, doing a pipette and taking a sample of the endometrium. One more thing, pap smears are not appropriate if you see an abnormal cervix. Let me just put this right here in the middle. If the cervix is abnormal, do not do a pap smear, ever. You could actually miss the abnormality. The pap smear may not pick it up. The appropriate investigation to do if you see an abnormality on the cervix is a punch biopsy. You need to biopsy the abnormal area and send it off for a histological diagnosis, not a cytological diagnosis. Let's quickly go through some alternatives to pap smears. Sorry, take this off. All right, pap smear alternatives. The first that I'm going to talk about is liquid-based cytology, and that is much more sensitive than a pap smear, much more specific than a pap smear, and the reason that we don't do it all the time is that it's quite expensive. The next alternative is HPV testing. Now we know that cervical cancer is almost exclusively related to HPV infection, specifically talking about squamous cell cancers. So testing for HPV is an alternative screening test in women who are more than 30 years old. If high-risk HPV is found, so 16 and 18, this would be followed by colposcopy. The downside is that it's quite expensive, but it is useful for patients with ASCUS, so abnormal squamous cells of uncertain significance, of unknown significance, sorry. It's useful to test those patients for HPV, and if it's positive, then they can go for colposcopy. And the last alternative is visual inspection. So this is cheap. You look at the cervix, and once you find an abnormality, you can treat it immediately. And there's two different methods you can use here. Visual inspection with acetic acid, and this is also used at colposcopy. So acetic acid is applied to the cervix, and the abnormal cells express a protein that the normal cells do not. And when the acetic acid is applied, the proteins coagulate and they become white. So the white area is abnormal. And another method is Lugol's iodine, and this is also called Schiller's test. So glycogen, when it's combined with iodine turns black or a dark brown. Normal cells contain, oh, I've written the wrong thing there. Normal cells contain glycogen. But the precancerous cells have far less glycogen because they are metabolizing and growing so quickly. So when the glycogen is added to the cervix, the precancerous cells go a mustard color while the normal cells go a dark brown or a black. So the mustard color cells are abnormal.